When talking about countries with few cancer cases, people tend to think that they enjoy excellent health, but the reality is different. Some of these countries are actually among the 10 least healthy in Europe. Today, following data from the World Health Organization, we will discover which are the 10 European nations with the lowest cancer rates. Despite conducting numerous searches, we found only a few studies that explain why these nations have low cancer rates. So, we want to ask for your opinion. Why do you think some of these countries, despite not having good overall health, report few cases of cancer? Welcome to this new video from Amazing Europe. Number 10. Cyprus. The health of Cypriots has long been associated with a healthy lifestyle, characterized by good nutrition and regular physical activity, which help maintain a low cancer rate compared to other European countries. However, in recent years, something has changed. Cases of thyroid and breast cancer have increased significantly, partly due to lifestyle changes. Obesity and an unbalanced diet are two factors experts blame. Today, almost 60% of Cypriot men are overweight or obese, compared to 40% of women. The situation is particularly alarming among young people, with 24.1% of boys suffering from obesity. However, it seems that lifestyle alone is not causing the cancers. Despite a significant decrease in the number of smokers, lung cancers have not decreased, suggesting other factors are at play. Another concerning aspect is the high rate of childhood cancers, one of the highest in Europe. Experts are investigating 4 possible causes: obesity, ionizing radiation, arsenic, and cancer predisposing genetic syndromes. In Cyprus, the use of arsenic in medicine and cosmetics, particularly in the Nicosia district, seems to be higher than in other European countries. Despite these challenges, Cyprus remains one of the countries with the lowest cancer rates in Europe, with 507 cases per 100,000 inhabitants and a survival rate of 54%. Number 9. Belarus. Belarus is a country with serious health issues, yet paradoxically, it registers a relatively low number of cancer cases. However, cancers increased significantly after the Chernobyl disaster. Right after the accident, cases of prostate, kidney, and especially thyroid cancer skyrocketed, with the latter increasing up to 4 times compared to the pre-Chernobyl period. Today, cancers directly related to that event have decreased but have not completely disappeared. Nevertheless, Belarus has one of the lowest cancer rates in Europe. According to the World Health Organization, there are 492 cases per 100,000 inhabitants, with a survival rate of 51%. But this doesn't mean the health situation is positive. The country leads the world rankings for alcohol-related deaths, and men, who drink and smoke much more than women, live on average 10 years less. Additionally, men smoke twice as much as women, and most of the population is overweight. While cancer is not widespread, cardiovascular diseases and strokes are common. Coronary heart disease alone accounts for nearly half of the deaths in Belarus, a worrying figure that underscores the fragility of the country's healthcare system. Number 8. Serbia. Serbia is a country of great contradictions when it comes to cancer. Although it is among the European countries with the fewest cases, it ranks 17th in terms of cancer-related deaths. With 486 cancer cases per 100,000 inhabitants, the mortality rate is 276 deaths, meaning that only 43% of patients survive. This worrying situation seems to depend largely on deficiencies in the healthcare system. For example, an official report revealed that between 2017 and 2022, 3/4 of Serbian health centers did not perform breast cancer screening. The reasons are not only linked to the COVID-19 pandemic but also to a lack of equipment, staff, and poor organization. Additionally, 70% of cancers are diagnosed at an advanced stage, often making surgery impossible. This makes Serbia, despite its low number of cases, the second country in the world for lung cancer mortality. Experts state that the main causes are smoking and pollution. Almost a third of Serbians are smokers, and 1/5 of adolescents aged 11 to 15 have already tried e-cigarettes. While these are considered less harmful than traditional cigarettes, there is concern that starting so young may lead these youths to switch to more dangerous cigarettes in the future. Number 7. Bulgaria. According to Eurostat data, Bulgaria is the only country in the European Union where life expectancy has decreased in recent years. Regarding cancer, although it is among the European nations with the fewest cases, with 479 cases per 100,000 inhabitants, it ranks 18th in mortality, with a survival rate of just 43%. One of the main causes of this paradox seems to be the lack of preventive care in the healthcare system. According to Eurostat, in countries like Finland and Denmark, 80% of women between the ages of 50 and 69 were screened for breast cancer between 2016 and 2018. In Bulgaria, however, during the same period, only 1 in 5 women underwent screening. Even more concerning is the situation regarding colon cancer. Bulgaria is among the European countries with the highest rates of incidence of this type of cancer. This is not at all surprising, given that only 1 in 10 Bulgarians aged 50 to 74 undergoes preventive checkups, while in Germany, 80% of the same age group regularly gets screened. Some of you may find it strange to hear these negative reports about countries with fewer cancer cases in Europe. Indeed, there is a great contradiction. Why do you think these nations have fewer cancer cases than others but generally poorer health? Number 6. Bosnia and Herzegovina. The healthcare situation in Bosnia and Herzegovina is much more complex than it appears at first glance. According to the World Health Organization, there are 439 cases per 100,000 inhabitants, but the reality seems to be even more concerning. The president of the country's Association of Oncologists has raised an alarm. The situation is worsening, but it is impossible to quantify the extent of the problem. He stated, "All available information indicates that the number of patients is increasing, but we have no official data because we don't have a national patient registry, no research has been conducted, and no one has done anything in the last 25 years." His words highlight a dramatic healthcare reality. The doctor also noted that the importance of having an accurate registry can be seen in the fact that since the Czech Republic adopted one, mortality has decreased by 12%. According to the doctor, similar results could be achieved in Bosnia if only more attention were paid. Another alarming figure concerns the mortality rate from cervical cancer, often caused by the human papillomavirus. Some doctors claim that the high incidence of this cancer in the country is due to difficulties accessing the vaccine against it. In fact, very few vaccines are available, and the ones that cost just over €100, an unaffordable sum for many Bosnians. This nation has a survival rate of 40%, the second lowest in all of Europe. Number 5. Montenegro. With 436 cases per 100,000 inhabitants, Montenegro ranks 5th among European countries with the fewest cancer cases. Experts cannot precisely explain the reason for this low incidence but predict a 60% increase by 2040, mainly due to unhealthy lifestyles and an inadequate healthcare system. The country is among the top 10 in Europe where the population experiences poor health. Smoking is one of the leading causes of illness, responsible for 28% of deaths, and 26% of adults are obese. However, these factors primarily cause other diseases. In fact, 60% of deaths in Montenegro are caused by coronary heart disease and strokes, while cancer accounts for 15%. Despite the lower number of cases compared to the rest of Europe, Montenegro has a high cancer mortality rate, with only 44% of patients surviving. This could be linked to the poor quality of the healthcare system, often considered the worst in the continent. To give an example, in the first 6 months of 2019 alone, 265 cases of hospital infections were recorded due to poor hygiene conditions. Additionally, there is a severe shortage of medical and nursing staff. In 2015, there were only 17 pharmacists per 100,000 inhabitants, as many healthcare professionals emigrated. Number 4. Moldova. Let's start with the bad news. Moldova has the lowest life expectancy in Europe. Women live on average 7 years less than other European women, while for men, the gap increases to 10 years. These are the top 5 causes of death in Moldova. As you can see, lung cancer causes the most deaths related to cancer in Moldova, but it accounts for only 3% of total deaths, much lower than in other European nations. Unfortunately, this situation is heavily influenced not only by unhealthy lifestyles but also by a healthcare system plagued by corruption. In the past 5 years, the Prosecutor's Office and the National Anti-Corruption Center have initiated over 140 investigations into bribes received by healthcare workers for surgeries, consultations, or urgent medical examinations. These bribes range from a few dozen to thousands of euros, and many doctors involved continue to work undisturbed in public hospitals or private clinics. Even the Oncology Institute, the only facility specialized in cancer treatment in Moldova, has been implicated in these scandals. With only 750 beds and 320 doctors, it serves a population of 2.5 million people. Due to the need for timely interventions, patients are often forced to pay to speed up the process, further worsening the survival rate, which is among the lowest in Europe. Moldova has 369 cases per 100,000 inhabitants, but only 45% of these patients survive. Number 3, North Macedonia. In this country, there is also a low survival rate, even though the number of cases is small. In fact, only 42% of the 363 cases per 100,000 inhabitants survive. Here, too, part of the problem seems to lie with the insufficient and corrupt healthcare system. In 2023, a major scandal erupted at the main cancer treatment clinic in North Macedonia. It was discovered that there was a well-developed criminal network within the clinic involved in the theft of expensive drugs through the creation of fictitious patients, with the drugs then being resold on the black market. According to some sources, almost 95% of the doctors and staff at the clinic were involved in this scheme. Moreover, there seems to have been poor management at the clinic, leading to about €20 million of debt. The former president of North Macedonia said, "The healthcare system has failed, losing trust not only among those patients but also raising questions about the quality of care for every future patient. The healthcare system seems unable to cope with the increasing number of cancer cases that plague this nation." Although North Macedonia is one of the countries with the fewest cancer cases in Europe, these numbers have been rising significantly in recent years. For example, in 2022, one woman died each day from breast cancer, the highest number in the past decade. Number 2, Ukraine. Ukraine has one of the lowest cancer rates in Europe, with 359 cases per 100,000 people. Fortunately, there aren't more cases, because the condition of those affected has significantly worsened due to the war. The conflict causes not only direct but also indirect deaths, with cancer patients being among the first to suffer. They face unimaginable challenges: loss of family structure, war-related stress, destroyed hospitals, lack of transportation, shortage of essential medications, lack of equipment and medical teams, financial devastation, and sometimes even the inability to provide basic care. For instance, the National Cancer Institute, one of the most important institutions for cancer patients, had over 1,000 employees before the war. Now, there are only 150 left. Many doctors are forced to send some children with cancer to highly specialized hospitals in Germany, Italy, Spain, and even the United States. All this is happening in a nation where health was already poor. Smoking, obesity, poor diet, and other factors contribute to making coronary heart disease the cause of half of all deaths in Ukraine. Before revealing the number 1 country and asking you some questions, if you found this video informative, we kindly ask you to give it a like, subscribe to the channel, and click the bell to not miss our new videos. This simple gesture can help us a lot in spreading our project. Thank you very much. Number 1, Albania. Albania holds 2 records. It is the European country with the fewest cancer cases relative to its population but also has the highest mortality rate. The country counts only 280 cases per 100,000 inhabitants, but only 38% of these will survive. Some claim that the low cancer incidence is due to low alcohol consumption and the high intake of vegetables in this country. However, Albanians also consume much more animal protein than the maximum recommended by the World Health Organization. Other serious issues include the high percentage of smokers and the very low level of physical activity among Albanians. This has led to more than 60% of deaths being attributed to coronary heart disease and strokes. There has also been a worrying rise in cancer among young people. Specifically, there is an increase in testicular cancer in men under 30 and an increase in breast cancer in women under 40. Additionally, there is a growing problem of healthcare staff shortages, especially nurses, many of whom emigrate abroad. Although cancer cases are currently low compared to other European nations, experts predict a 40% increase by 2050. Now we have some questions for our community. As you've seen, many of the nations with the fewest cancer cases are also among those with the worst overall health. How do you think this is possible? What causes these nations to have fewer cancer cases than others but worse health overall? Do you think there are other causes of cancer besides the traditionally known ones that could explain why these countries have so few cases? Experts point to smoking, diet, obesity, pollution, and similar factors. Do you think there are other causes? Let us know in the comments. You can't fully understand this video without checking out the one in the top right corner, where we examine the 10 European countries with the worst health. That's all for this video. See you next time.